Good afternoon, friends. Welcome back to Pediatric classes. Hope all are doing well. Today, I am going to discuss about an important topic, that is flu vaccine. Today, I will be basing my discussion on the purple book based on that. So what exactly is this purple book? You will be wondering, right? So many of the Indian pediatricians, we will be knowing that IAPA has brought out a book, purple book, that is on immunization. It's a really very nice book. I really want to thank the seniors and the friends who actually worked a lot for that. Special thanks to Ramesh sir, Bobendra sir, and so all the people who have toiled day in and out for the book. Okay, so this flu vaccine will be discussion will be based on the from CDC and also the IAP ACVIP 2022. That is based on the purple book. I thought I'll get the thing. So what does a flu vaccine protect against? As you all know, it protects against infection by influenza viruses, which causes common cold or flu. So this is a time for flu and all. So that's why I thought I'll discuss that today. So what are influenza viruses? Influenza viruses are orthomyxoviruses. That is, they are single-stranded RNA viruses. There are three types of viruses: type A, type B, and type C. Okay, type A, the further subtypes are determined by hemagglutinin and neuraminidase. That receptors, you can actually see that thing on the surface. Okay, hemagglutinin and neuraminidase. Then that type A causes mostly moderate to severe illness. Type B, it causes mild disease, mostly affecting children. Type C is rarely reported. Okay. Coming to seasonality in India, we have actually a year-round infection of influenza with peaks, 2 peaks almost. It is winter, it is in Jan to March, and also proposed monsoon, August to October. Actually, the season differs from northern hemisphere to southern hemisphere, or even from northern India to southern India. There are differences, okay? But generally in India, we have an year-round infection. So, what is this? This viruses are very prone for frequent mutations, and there are two types of it. You would have learned it in our undergraduate classes. That is called antigenic drift and antigenic shift. But antigenic drift means small changes, okay? That will cause generally an epidemic like A and type A, type B, all this is. Antigenic shift is a major change which is happening in the genetic makeup of the influenza virus. This generally goes and causes pandemics. Like, for example, type A viruses that can cause a pandemic. Example, H1N1. So, this thing is important to understand that vaccines will elicit a relatively strain-specific humoral response and have reduced efficacy against antigenically drifted viruses. That is precisely the reason why the vaccine should incorporate the current strain, and we are requiring an annual vaccination depending upon the strain. Now will ask me, how will I know what is the current vaccine or which strain is currently prevailing? And that is why we have a surveillance, the WHO GISRS, that is the Global Influenza Surveillance Response System, updates the composition of viruses twice a year. Actually, they have very good surveillance system of multiple labs and other things, and they comes out. They holds meeting 2 times in a year for the world. One February for the northern hemisphere and September for the southern hemisphere, and they tell us about what exactly is the current virus, which is the prevalent thing which is running or going to run. So depends on that, the vaccine will be made available in 6 months. So for southern hemisphere, if you ask me, in September they will hold a meeting, and the current strain that will be available by March to April. So, and one thing to note here is the strains are different, timing is different, everything is different for northern and southern hemisphere, and WHO recommends 2 vaccines for both hemispheres, and it should be given at least 2 weeks prior to the season. So what exactly is the disease burden? The annual attack rate is 5 to 10% in adults and 20 to 30% in children globally. That will cause around 5 to 10% all acute respiratory infections. What is the strain in 2021? That was H3N2 followed by B Victoria. 2022 was H1N1 PDF09. So this all keep on changing. Okay, so one thing you should understand here, whatever strains which you are going to use, at least 2023, which should have all these strains. The US Center for Disease Control and Prevention, that is CDC, recommends that influenza vaccine or flu shots are otherwise called as shots, okay, are the best way to prevent or protect people against the flu and prevent its spread. So what are the types of vaccines available? They are actually inactivated influenza vaccine, live attenuated influenza vaccine, LAIV, or recombinant influenza vaccine. Let us now actually look into detail about these vaccines. First one is inactivated influenza vaccines, IIV, inactivated influenza vaccine. They are manufactured using virus grown in eggs. Three types. One is whole virus, but this is not very much used now because they have increased adverse reaction, especially in children. Then we have subunit surface antigen, which uses purified hemagglutinin and neuraminidase. And we also have split product vaccine from detergent-treated highly purified influenza viruses. So there are two types again, trivalent and quadrivalent. Previously, trivalent means TIIV, that is trivalent inactivated influenza vaccine that protects against three strains. That is influenza A, two strains of it, that is H1N1 and H3N2, and one influenza T strain. To increase immunogenicity, some trivalent vaccines uses oil and water adjuvants or virosomes. They are actually called adjuvanted trivalent influenza vaccine A, TIIVs, which actually have enhanced protection and boosting. What about this quadrivalent QIIVs? They are current seasonal influenza vaccines. This includes 4 strains, 2 influenza A strains and 2 influenza B strains. Influenza A strains are H1N1 and H3N2. Example, Vaxigripp, Tetra, Flu, Quadri, and other things. So, whom to give all these vaccines? Yes, flu vaccines are recommended for all children from 6 months to 5 years. And beyond 5 years, we recommend for high-risk children. That means those children who are having chronic cardiac, pulmonary, excluding asthma, okay? Hematologic and renal, including nephritic syndrome, chronic liver disease, diabetes mellitus, congenital or acquired immunodeficiency, children on long-term salicylate therapies, and also to elderly, more than 65 years, pregnant ladies, healthcare workers, etc. Healthcare workers, why? Because we are actually exposed to infection many times. What is the dosage? Dosage is 0.5 ml, that is 15 microgram intramuscular. What is the schedule? 6 months to 8 years. For the first time you are giving, you should give 2 doses, 4 weeks apart. More than 8 years, you should be giving only 1 dose. And make sure that you revaccinate the child with a single annual dose till the age of 5 years and beyond 5 years for higher risk groups. Okay. So that means there are 2 doses for smaller children from 6 months to 8 years with 4 weeks gap. After 8 years, it is a single dose, but there is annual revaccination with a single shot. Annual revaccination is recommended. Why? Because the strains keep on changing every year, like we have discussed previously. So how much is the protection? See, please note, there is a primed individual and an unprimed individual. Primed individual means who have already actually taken a vaccine or a previous day. So those people, once you give a shot, the antibodies peak at around 2 to 4 weeks. Whereas an unprimed person will start protection 4 weeks or later. So that's why we are telling before the season, at least 2 weeks prior, we should be giving the flu vaccine for a primed individual. For unprimed, better we start at least 4 weeks before. So what exactly is the efficacy of quadrivalent vaccines? It is 63.2% efficacy against moderate to severe infections and 49.8% efficacy against influenza of any severity in children 6 months to 35 months of age. Why there is a relatively decreased protection? This is due to change of strain, which is happening every year. What are the adverse effects following immunization? There can be transient local reactions. There's a slightly increased risk of GBS. So preferably it is avoided in patients with history of GBS and who are not on high risk for influenza-related complications. See, what about the people who are having egg allergy? So please note here, the people, suppose they are having egg allergy and has had symptoms other than hives, okay? Hives means it's okay, but other than hives, like for example, breathlessness, like that which happens, they should be vaccinated in a medical setting supervised by a healthcare provider who is able to recognize and manage severe allergic reactions. Absolute contraindication are severe allergic reaction to vaccine component or to a previous dose. What are the precautions and precautions of this vaccine? This include moderate to severe acute illness, history of GBS within 6 weeks of receipt of influenza vaccine, or history of egg allergy. Now coming to live attenuated influenza vaccine, they are made with attenuated or weakened live flu viruses. Please note here the age group recommended for this age is 2 years to 49 years. There's a quadrivalent live attenuated vaccine that is intranasal, contains 2 influenza A strains and 2 influenza B strains named Nasovac S4. They are available as nasal spray, single nasal spray, 0.5 ml in each nostril. But there are contraindications less than 2 years you should not be giving. 2 to 5 years who have had a wheezing episode the past 12 months also we don't recommend nasal vaccine. 2 years to 7 years who are receiving aspirin or salicylate containing medications also live attenuated vaccines are not recommended. They are also not supposedly to be given for pregnant ladies, immunocompromised people or persons with certain medical conditions. Precautions again, moderate to severe acute illness with or without fever, history of GBS within 6 weeks of receipt of influenza vaccine, asthma in persons more than or equal to 5 years, or underlying chronic medical conditions. In such patients, better we avoid live attenuated vaccines. There is another type of vaccine called recombinant influenza vaccine, RIV. They are recommended for beyond 8 years only. It isn't manufactured or grown from eggs, so there is no question or tension for people for having egg allergies. So this will make it a suitable alternative for those who have severe allergy. We need not have to worry about it about recombinant influenza vaccine for people with egg allergy. And they are made without flu viruses and contain 3 times the antigen. Example, flu blocks quadrivalent. I really don't know whether I am audible much because heavy rain is going on here. What are the routes of administration? The routes of administration, inactivated vaccine, it is 0.5 ml IM. Live attenuated nasal spray, we are giving 1 puff in each nostril from 2 years to 49 years of age. Recombinant, again 0.5 ml IM. So which vaccine should I give? In those with underlying risk factors, only inactivated vaccines can be given. In healthy individuals, 2 to 49 years, either inactivated or live attenuated vaccines may be used. And when should I give it? WHO recommends at least 2 weeks prior to the influenza season for that particular region, we should be giving the vaccine. And we should have a staggered approach of vaccination. Mostly, the recommendation right now, according to the IAP, ACVIP guidelines, that book says April to May for entire country except Tamil Nadu and Southern Kerala, where they recommend October to December. And northern parts, Jammu Kashmir, their recommendation is October to December. But most of the time, if you can remember, it is around April to May. What are the advantages of flu vaccine? So this will help you or keep you from getting sick with flu. Even if you get flu, they will reduce the severity of illness in those people who get vaccinated. And it also reduces the risk of hospitalization. And it will actually help or act as an important preventive tool for people with certain chronic health conditions. So these are the advantages of flu vaccine. I hope the session is clear for you. This is the time where there are lots of flu cases are there. So that's why I thought I'll come up with this discussion on flu vaccine. Hope you are clear with it. If you have any doubts or clarification, please don't hesitate to put it in the comment box. Please do like and share with your friends. Thank you so much and stay safe.